Hey, if you want to heal your body naturally, lose that toxic weight and transform your mind so that weight never comes back, I want to invite you to join my Mind Body Boss mentorship program where I use my proven formula to help you achieve that. Click on the link in the description to learn more. See you on the inside. Welcome, Dr. Austyn Yarbrough. So excited to have you here.
Thank you for having me. I'm so excited.
Thank you. If you don't mind, just tell us a little bit about yourself.
Yeah. I'm a licensed chiropractic physician and a licensed functional medicine doctor. I specialize in gut health, hormones, and detoxification, weight loss as well, because we know those things all go hand in hand. And I work in person and virtually. So I do about half and half. I attended Ole Miss for undergrad, did half my degree in Australia, studying holistic medicine, exercise science, and then went on. I was pre-med, went on to doctorate school after that, where I went to chiropractic school and then did more extensive training in functional medicine. And I love what I do.
That's amazing. That's a nice resume right there.
It's a good resume
Awesome.
just for myself.
I love it. And here you are, like doing all this amazing work, which we'll get into in a little bit. But the main reason I wanted to have you on is not only because I have followed you for a while and we connected on Instagram um, through like the whole like health and nutrition and detox.
Yep.
But recently you actually went through an explant surgery,
Yes.
removing breast implants. And I've seen a lot of this lately with like a lot of like athletes. Like I used to be into like bodybuilding and stuff, and like it seems like most of the bikini and the athletes are removing the implants. Can you just kind of touch on like what has led you to the decision to remove your implants, breast implants?
Yeah. So I got my implants back in 2019 sporadically. I kind of share that story on my page, and I have been talking about this a lot. But to get them removed, I started having just some weird symptoms, just to be like transparent. I had COVID, which was back, right when COVID started. And then I do struggle with autoimmune issues. So that's always kind of been in my past, but I've always managed it holistically through just diet, lifestyle, nutrition, supplementation. And kind of post COVID, I just started having some really weird symptoms. I had breast tenderness, swelling in the breast. I had swelling in my lymph nodes, a
Hmm.
lot of gut issues, um, brain fog. I was actually having really trouble with a lot of trouble with insomnia. And I had never struggled with that before. So it was, I mean, as anyone knows, like when we don't sleep, we go nuts. Like I felt
Yeah.
like I was crazy. And so I just like started diving deep into like my labs and working with functional medicine doctors, seeing, some Western doctors as well, and just putting everything together, meeting with my surgeon, and kind of just came to the conclusion that my breasts were kind of my body was just kind of attacking my breasts. That's kind of the easiest way I can put it. And yeah, I already feel, and my surgery was August 8th, so it hasn't been long, and I already feel so much better. It's crazy. My lymph nodes are already less swollen. Breasts are a little sore, and this is post surgery. A little sore, but other than that, I actually lost 7 pounds after the surgery just from
Wow, just inflammation and just the swelling. Wow. So, it's interesting because you haven't had the implants for super long. I mean, 2019, like, 3.5 years. So it's interesting that you were able to like notice all those symptoms. Like, how long did it take after your implants before you started noticing a difference? Was it pretty early on, or it took, a year or two before you noticed those symptoms?
Yeah. So what we know from research and from me personally, I didn't notice the implants at all in the beginning. I felt like they weren't even there. My implants were really small. Again, I got them to just kind of even out my breasts. I do have some breast tissue, so it's not like I put these like massive implants in. But what we know from research on BII and that kind of stuff is that these symptoms can take up to like 3 to 5 years to actually start showing up.
Mhm.
And they are, located in like our chest cavity, which as
Yeah.
females, that's by a lot of nerves and lymph nodes, and puts us at risk for a lot of things and just in that area. So I did not start noticing them until probably 2 years after I got them. And I can't really pinpoint if COVID, was a factor, which I'm sure it was, because I do
Mhm.
struggle with autoimmune, and just having that in the background, and then my body just kind of trying to fight that off, as well as having this foreign object in my body. I think it was just like a double whammy, and it kind of just was like, all right, this is like I've hit its limit.
Yeah,
Yeah.
that's crazy. So, like, what are some of the common like um, symptoms for people that do end up getting an explant? I know you said like autoimmune, like some lymph node swelling, brain fog. Like, is there anything else that people that maybe do have implants that are like maybe wondering like what are some of the other things that you notice that change or
Definitely symptoms that, I've experienced, but also I work with patients holistically all the time. And I've, dove into this with other patients. And what I've seen is things from like muscle weakness, tingling, numbness, to
Hmm,
brain fog, major hormonal issues, estrogen dominant symptoms, breast swelling and tenderness, abnormal cycles. Um, I would say those are the main ones that I've seen. And then a lot of digestive issues, which we know, our
yeah,
hormones kind of feed off of our gut. So they both work hand in hand. But those are probably the top ones that I see and that I.
interesting. And does it matter whether it's like saline or silicone or is it all of the implants?
Yeah. So this is a question that I've gotten before. And, I'm not an expert on saline or silicone, in general. But what I can say, and in my like just opinion, professional opinion, is that any foreign object in your body is like not meant to be there, right? It could be a metal plate in your leg for, you know, if you broke your femur or whatever it is. Our body can attack anything that's in there.
Hmm.
And I think the BII world and the breast implant illness has just grown because, our breasts, like I said, are just in such a sacred location as a female. And I think it just affects us a lot more. So I don't necessarily think, the saline versus the silicone could be worse or better than the other. I wouldn't say that. Now it might differ if, if you have a leak, right?
Yeah.
But I would say, yeah, I would just say that any foreign object in your body that doesn't need to be there can definitely, attack our system.
So should I take my Brazilian butt implants out?
Do you have Brazilian butt?
I'm just kidding. No, I do not have Brazilian butt implants, no. But
I would
just
recommend.
I will work on that.
Yeah.
We'll probably do a podcast on removal. No, I'm just kidding. No, I do not have any implants anywhere. But yeah, I mean, we don't think about like all this stuff that we put on our body. And yeah, it is I mean, and just the material, whatever it's inside, whether it's silicone or saline, I think the capsule of the actual implant still is whatever it's made out of,
Yeah.
silicone, whatever else. So that makes sense. Um, so remove, like, I want to go, we'll talk about like your, uh, how you got ready for the surgery and all that stuff. But first of all, like to remove implants, right? Isn't that like a process? Like you want to make sure you get the capsule out and all. There is like an extensive process. So you want to make sure you go to a surgeon that is qualified to do the removal, right?
Yeah. Good question. I've had a lot of questions about this, and there is, a lot of politics when it comes to BII, which was very eye-opening for me when I started to get, you know, involved in everything and do my own research and that kind of stuff. I think with just anything, there's politics, right? But there's three ways you can get your implants out. And this is what I just kind of explained to people. You can be put under and you can get the implant and the capsule removed. You can be put under and you can just get the implant removed, and you can be basically awake, have local anesthesia, and just get the implant removed. I talked to 5 surgeons before and as well as did my own research and have like my little functional medicine group of practitioner friends that I kind of fed off of. And I actually chose not to get my capsule removed. Now, my implants weren't in there that long. Is there enough research to back that, there's toxins stuck on the capsule? I mean, probably there's toxins stuck on the capsule, right? Because an implant basically forms a capsule like just any body. It's kind of like scar tissue. It forms like a little sheath around the implant, which is the capsule, is what we're talking about if people aren't familiar. And what people say and what researchers have said is that they believe that the capsule, has all of these toxins attached as well. Now, the surgery is risky, so you have to kind of weigh the pros and cons. It's a very invasive surgery. You get very close to the lung. If you have, in-depth autoimmune stuff going on already, and maybe your immune system isn't great, it can be a risk, right? Just like any other surgery. And then also just being put out in general, if you've got gut issues or whatever, we know that the anesthesia can affect us too, depending on like what we have going on in our gut. And I've had plenty of the gut issues. That's a whole nother story. But yeah, those are the 3 ways you can get your implants removed. Now, your capsule is going to be a lot, less hardened. It's going to be a lot less attached to the implant. If they're not in for as long, I have patients that have had implants in for 30 years. And I mean, we see these implants removed and you have no choice, but you've got to get that capsule out because it's just literally a hard rock around the implant. So I, at the time, chose, because I've also kind of been going through some other health stuff, was to just not be put under. I actually stayed awake for the surgery, got my implant out, and did a ton of a gut protocol before, a ton of autoimmune support, and then same with after. And I felt like I didn't have surgery the day I had surgery, right? I was in and out and walking around, probably more than I should have been. But it's definitely one of those things that I think I came to conclusion, and I'm sorry this is such a long answer, but it's just kind of based on the patient, and from the surgeons that I've talked to, who are more holistic minded and more Western, and you put both of those together, I just decided that was the best for my body, and I'm going to see how I respond. And if I choose, and that I'm still having issues down the road or whatever, I might do the capsule later, separately. But right now, I will say I feel great. And I feel really happy with like the surgeon and all of the feedback that I got from a bunch of different people.
That's awesome. Well, that's actually very interesting that you mentioned that, because I thought like whenever you have breast implants, you always have to get the capsule out. So I'm glad that you kind of touched on that. I didn't really know that much about it. So thank you for explaining that. And I do anesthesia. You should have just called me. I would have just given you a little bit of something from it.
I needed you.
I know. I could have been right there. But that's pretty amazing. Do you remember stuff, or did they give you like burst and stuff to like, or do you remember?
I was fully awake. I was chatting with the surgeon the whole time.
So they just numbed you up.
Numbed me. They numbed. Honestly, I mean, I know me, and I know I have high pain tolerance, but like it really wasn't bad. I thought it was like, I told myself, I haven't had children, and I was like, if people can have children naturally, I can do this. Like as natural as I possibly can.
Yeah.
I'm not getting the capsule out, which is the downfall. And that's a lot more intense of a surgery. But there's ways like you can detox. We can't say that we can get the capsule out, right? But we can detox. We can use infrared sauna. I have a friend, actually, her name's Dr. Kate. it's her supplement name as well. And she actually has a silicone detox supplement. So I thought that was just genius. I was like, why didn't I think about
Yeah,
this? But yeah,
that's awesome.
I've been taking that. It is a blood thinner, so I stopped 2 weeks before surgery, but I've been taking that, before, after surgery, and working on my gut as well. And then once I can get back in that sauna, I will be in that sauna. I'm just waiting for those scars to heal up.
Yeah, that's my favorite. So the infrared sauna is, I got one of those like this year. It was best investment of my life. Yeah.
Best.
Um, and of course, like if you are considering, removing your implants or trying to decide, whether you're gonna get the capsule out, everything that we discuss here is obviously just for educational purposes. None of this is medical advice, especially that Dr. Austyn is a doctor, so we don't want, mislead anyone. So we're just sharing her story, and anything that we discuss, supplements, all that stuff is just for educational purposes, and you should always consult your doctor.
For sure.
So speaking of your supplements, I know you did a specific protocol prior to your procedure. Can you kind of describe like what you did and the supplements that you took and how long you did it for?
Yeah, yeah. So I actually have this all, which is so great. Definitely I'm gonna go over it. But just so everyone knows, the day of my surgery after I got home, I just can't sit still. That's the type of person I am. I created a with
Good.
to everything. So it's a free downloadable. It's on my Instagram with just like it's called Explant Essentials, and it kind of goes through some information on there for people because I was just getting so many questions, and I was
It's
like,
amazing. I looked through it and it's amazing. And I will link your Instagram and everything in the description as well. So
thank you. But yeah, so um supplement wise, before I went through my gut protocol. I have my own gut cleanse. So basically I was just taking some binders. If you're not familiar with binders, the point of binders is to just kind of bind to certain toxins in our body to try to pull those out. Now that's why we don't want to take binders when we're taking other supplements, because we don't want the binder to bind to other supplements that we're taking. So I was doing a lot of binders, a lot of infrared sauna as much as I could. I love doTERRA has a great complex. It's called the polyphenol deep blue complex. It's great for inflammation. There's been a ton of studies and research on some of their supplements, and I don't think people realize that. I actually have my own supplement company as well. So for me to rep something else is, it's a decent deal. And then I was doing a lot of like oils. Copaiba is great. It's great for inflammation. So I was doing that with the
what's the name of it?
Copaiba. So some people say Copaiba, but I guess the actual way that you're supposed to say it is Copaiba. So I've been trying to correct that lately. But yeah, so I've been doing that. That has so many different benefits too. It's a really good natural antihistamine. There is a great oil, and they're all linked as well. But it's called Immortel, and I'm actually using that for my scarring now, and I'm just putting it kind of like around. You can't really see, but if I would stand up, my scars are kind of down here, so I'm doing it around the scar area. Again, none of this is medical advice. It's just what I've chosen to do in more of a holistic way. And then I'm doing a lot of gut support. I mentioned my friend Dr. Kate's supplement. I'm doing colostrum. So that with protein, which is
So
going to
this
be
was this was before your explant surgery. And how long, like when did you start this whole protocol? Like a month ahead or?
yeah. I would say I started about a month ahead. And then you want to be careful with, and I think I note this on my, I know I note this on my printout, but you don't want to take any blood thinners before surgery. So I stopped all supplements for 2 weeks before my surgery. I kind of was going on a tangent there. I guess I wasn't doing the colostrum before surgery, but I was doing kind of all those other things for inflammation. And then post surgery, I added a couple more things in. And yeah, was doing some on guard tablets just for like just to help with my immune system, since it is a little bit weaker than others. I mean, before, this is crazy. This is actually a really crazy cool thing. I was telling a doctor earlier, before surgery, I had labs done about 2 weeks before. And I mean, my levels were all over the place. My white blood cells were super bottomed out. Monocytes were through the roof. I'm not going to get too technical, but I just had labs done directly after surgery, and all these things have already drastically improved.
Crazy.
Yeah, so I don't want to call it a coincidence, but I feel
Mm,
better too.
That's that's insane. And I know you mentioned you're taking some doTERRA supplements, and I'm shocked myself because I love doTERRA oils and I use it pretty much every night when I go to bed or even just like diffusing it at home. But I had no idea that they had supplements. Like I was like blown away. So
Yeah, yeah.
yeah, check them
Supplements
out.
are great quality too.
That's
There's
awesome.
a lot of testing, and they have a whole bibliography. I've actually met one of the CEOs,
Wow.
Sarah. I've been to the lab, um,
Wow.
in the testing, and yeah, it's pretty mind blowing. And
This is,
those are the kind of companies that you want to, affiliate yourself with and back, right? Like whether it's that or any other company, you want to do your research and know your stuff.
and then you also have your own supplements as well.
Yeah.
Is that and like how did that I mean I don't mean to like get off the subject, but how did that start? Like how did you start developing your own supplements?
Yeah. So those are more just like just basic supplements that I thought would be good for just kind of everyday patients that I was seeing in the office that everyone kind of sort of needed in their daily life. And so many people don't even realize like they're so deficient in vitamin D, but when they're taking a D, they need the K2, right? You need to take the
Yeah.
D with the K2 to be able to absorb. So I just created a couple things that were plant-based, and just like very easy on the stomach, easily absorbable. That would kind of benefit every patient, to be honest. And then for my more in-depth stuff, I reach out to other companies. Like I've got a whole list of them that I kind of rep, but it depends on the patient, right? I'm using different supplements from different companies for different things. But yeah, that was I guess like 2 years ago now. So it's just kind of really been getting going, which has been great. And like I said, I rep a lot of other companies as well.
Pretty awesome. Yeah, I love it. So then you went back to you had your surgery about 2 weeks ago. Well,
Yeah, I
almost
was on the 8th.
yeah,
So
2 weeks
yep.
ago, yeah. And then went back home, you could tell a difference immediately and just like swelling
Yeah.
and just inflammation and just everything. So after the surgery, how like what did you incorporate in your recovery? Was it the same supplements? You just continue using the binders and are there any particular binders too, like charcoal, activated charcoal, or like zeolite? I know there's so many different ones
Yeah.
that you can take.
Yeah. I like so Cellcore has a good binder. They have a really good binder on their line. I also like Biocidin Botanicals. They have a great line of a binder. So I actually was taking the Biocidin binder and then adding on kind of after surgery, because I know I talked about a couple things before. I was adding in colostrum, doing a lot of electrolytes, protein, making sure just for like that muscle recovery, lots of protein. I was doing, what else am I doing? I'm doing On Guard, which is actually from doTERRA. That's to help like boost my immune system as well. So I continued that. Did the polyphenol deep blue. So that's a really good one for pain and inflammation. I use the lotion actually on like every patient that I see in the office.
Is that from doTERRA?
It is, yeah.
Yeah.
That's probably really like my favorite supplement that they have. Just with the feedback that I've gotten with patients. And then copaiba for inflammation. There's an oil, it's called Immortel, and it's actually shown to just help with the healing and the scarring and everything around. So I'm doing that. It's a little roller. So I'm doing that kind of around the scar. I'm not putting anything directly over it. And then helichrysum is also really good for like wounds and cuts and that kind of stuff. Haven't used that yet. Again, I'm kind of letting myself heal, keeping like a compressed bra on for now. But I mean, I'm like blown away with the recovery compared to like when I even got the implants in the first place. Like I feel like I bounced back so fast.
That's amazing. And another question, did you have the same surgeon remove your implants that put your implants in?
I
Yeah.
did. Yeah. I
Oh, that's
got I got 5 opinions, and it's so funny. He was great. He actually told me to go because he knows, I just did all my research, and he's like, you need to just like feel good for yourself. So I want you to go talk to my friend. Her name's Dr. McGuire. My surgery was in St. Louis, Missouri. That's where I'm originally from. So I went back there to kind of stay with my family. And she actually has done a ton of research on BII in her office with patients that come into our office. So that's another thing, like with surgeons and plastic surgeons, like doing implants and stuff like that. I think it's super important to go to someone that really believes in BII because it is a thing. And
yeah.
some surgeons, will blow you off. It's just like any doctor or whoever you're talking to, like people can blow you off, right? So you want to go to someone that believes in it, that like believes in you. So he actually sent me to her, and she was great. She's so funny. She's just this loud, like kind of this loud like lady, and she's just doesn't have really a filter, which I love. And I was like, all right, tell me this.
That's my kind of girl right there.
Yeah,
Yeah.
my kind of girl. And we ended up getting a picture. It was like the whole thing. But yeah, she showed me her studies, and she was like really transparent, and I felt really, really good with the feedback that she gave me. And then I actually had a couple opinions here as well, just from a couple friends that had gone through the explant process. So yeah, it ended up doing great. I ended up going with Dr. Nathan, who was at St. Louis Cosmetic Surgery, doing it at the in-office. Like they have like a little in-office surgery room because I chose not to go under. And it was quick, easy, pretty not too painful. Felt some pain, but
What was the most uncomfortable part of it? I know they numb your skin underneath and stuff, but I'm sure some pressure and like pulling the.
sure, yeah. Um, sure, I thought that was gonna be worse. Like he was like doing my left, and he's like, I'm like, okay, yeah, just like let me know when it's coming. And he's like, it's out. I'm like, oh, okay. And then honestly, I think the most pain was they put drains in me. And my drains, like just the drain incision on the side, was probably the most painful. And they were the most annoying. I only had them for 2 days. Thank the Lord, because I was like over those things. But like I feel for anyone that has to have those, whatever you're going through, it just sucks. But I think that was the most annoying and most painful part. And I'm still kind of sore on the sides. Other than that, like just a little pressure. I was numb for the most part. They did a great job. Like I also did, they probably thought I was like a crazy, like oil holistic weirdo lady because I like came in. I have like my oils, and I'm like got my meditation music and like my hypnosis playlist. He's like, whatever you gotta do. That's also why.
I love it. That's awesome.
They're like, girl, whatever you gotta do. So I did that. Some like hypnosis and yeah, some oils to kind of calm me down. And that was really it.
How long did it take? How long did the surgery take?
The prepping and the cleanup is the longest part. I would say the surgery itself took about 20 minutes,
Oh,
20 to 30
yeah.
minutes. Quick procedure. I mean, obviously they're prepping you and doing everything. I would say maybe 30 to 40 minutes, but I also think they're a lot more, and you can probably speak for this. I think, they might be a little more careful if you're awake and more just like aware because you're there,
Yeah,
you're walking. So they have to be just extra cautious. So that kind of made me feel good too because they were constantly asking me like, "You feeling okay? You doing
yeah,
okay?" So that was good, I think.
I agree. So I know you've done a lot of research on all this whole subject of BII and stuff, but does everybody that gets implants, are they, is everybody at risk for breast illness, breast implant illness, or do some people just are okay with it? Like, what are your
Yeah.
thoughts on it?
Yeah, that's a really good question. I had this question asked to me the other day when I was actually on another podcast talking about it. And honestly, here's the thing. Like if you have any sort of foreign object in your body, you're at risk for anything, right? anyone, I think it puts you at risk just because you're going through that decision and going through the process of putting something foreign in your body. Now, do some people not respond and have like any symptoms? Of course they don't. That's, the same thing with like my dad. He has a cage in his back and from a fall, and he actually had a weird reaction to that at the beginning. But, some people get that put in and they're like, oh my gosh, best surgery in my life, helped my back and I feel great. So you're definitely more at risk if you have higher risk factors like autoimmune and, different things or whatever it is. But putting something like that in your body, we know, like, I don't even want to bring up the breast cancer subject, but we know like 1 in 3 women, I think these days get breast cancer, which is such a high statistic. And if we're putting something in that could possibly cause like estrogen dominance, we want to be careful with that stuff just because, we're already at risk in society with all these environmental toxins in our food and our water. So in my opinion, I got asked a really hard question the other day, and it was like, would you have done it, or would you have gone back and done it differently? And I think if I knew what I knew now, I wouldn't have gone through with it, but I wouldn't have also learned all of the stuff that I've learned. So it's just kind of like one of those things that you can't dwell on the past, and you've got to just kind of move forward and learn from what you went through, right? And then reach out and speak to people, because I wasn't going to do that at the beginning. I was kind of embarrassed. And like the feedback that I've gotten has been crazy.
And exactly, you're here helping other women that are maybe going through the same stuff, and you can educate them and help them get through it and not feel embarrassed. Like, yes, sometimes you get implants for whatever reasons. It doesn't matter, and it shouldn't be any shame. And it's like, if you feel like it just doesn't feel right in your body, take it out. Do whatever you need to do to feel good.
Yeah, it's anything. It's like if you feel like, a doctor's telling you that everything's fine and to just kind of you just forget about it, like, and you feel in your gut that it's not, then speak up or get a second opinion, because I've been there too, and it doesn't get you anywhere.
Yeah. Do you, like, when you went for a consultation for your breast implants, did like do the surgeons, because I don't know how that works actually, do the surgeons mention this like to patients, like, hey, there's a possibility of breast illness, like that could be something? No, they don't
No,
talk about
so I will straight up say, so I was like also at the very beginning of my holistic school journey in doctorate school. And I had actually met with a couple professors before I even went in to go like in with the surgery, talked to them, got their opinion. One was actually a surgeon. So I talked to her. I talked to a couple other professors. I brought in some articles about BII when it wasn't even really a known thing yet. And
Wow.
presented it to the doctor, and he mentioned it, and he was like, he was telling us like the risk factors and all kinds of stuff, and he was very open with it, which I thought was really nice of a surgeon to do, because obviously that's their job, right, is to do surgery, especially plastic surgery. So I had asked about it, but not at all are they going to bring that up. I will say also, a lot of people think, at least like I thought this, and maybe call me naive or whatever, but before I learned just more details about it, they told me that I had a warranty, a 10-year warranty on my implants. And this warranty is like a different company. So it's not necessarily the practice that I went to get my implants, right? Like they work with a third party company. And the warranty company is just completely awful. Like they don't cover anything unless you can prove that you basically have lymphoma or you have
Wow.
laceration in your implant. And I've talked to a couple of friends that have gotten their implants out, and they were willing to actually take out my implants, put new implants in, but they wouldn't take my implants out, even with the lab that I sent. Yeah.
Oh
So,
my gosh. Wow.
so there are some like things that you can do, some like codes if your surgeon's willing to go through insurance. I wouldn't say it's a high probability that they will, because they probably don't make much money off of that, right? I know just in practice, like I don't make money off of insurance. Like
Yeah.
it, it's a pain in the butt, but yeah, it's definitely something that I was not aware of. I was thinking I had this warranty and it would protect me if anything happened, which it did. I was sick, and it definitely didn't do anything.
Wow, that's crazy. But
It's all a money thing.
money. And I have like previously asked surgeons that I've previously have worked with, and I've done breast implants, insertions, not myself, but
Yeah.
provided an anesthesia to for explants and implants. And most of the times that I've asked the surgeons, like, what are your thoughts? And like, I don't know, a lot of people sometimes exaggerate and they make things up because this has become this thing to do now. And
Yeah.
I'm just like, yeah, okay. So do your research, you know what you feel, you know the difference. Like, yes, we can all have opinions and think this or that, but at the end of the day, you know yourself well, and you need to listen to your inner self. If something feels weird or wrong, it probably is.
Amen. Yeah. I think it's really patient based. And like also, like you said, I think that's the answer that a lot of people like to give when they don't even know enough about
Yeah.
it. Um, that's probably be the answer that I would give if I didn't know. So yeah, like just if that's the case, just say, I just don't have knowledge on the topic, but know your stuff before you're saying one way or the other. I feel like.
Yeah. I mean, I even talked to a dentist the other day, a friend of mine, and I asked about like mercury fillings because
Yeah,
that's been a big thing. He's like, no, there's no research on it. And I'm like, there is.
there is.
I mean, like I had like three mercury fillings because in Europe, that's all they did, mercury back then. And
Wow.
I decided to remove it after several friends, dentist friends told me there's no correlation. I'm like, I know there is because I can feel it here in my brain. The brain fog was awful.
Yeah.
And I removed it. I went through the protocol, the detox protocol, kind of similar with the binders and stuff. And I have noticed a huge difference. So
Amazing.
again, yes, there might be research versus, and again, what's research? Sometimes research is very subjective too. It's like money and yeah. So
Yeah.
there's so much.
Let's research. I love that because it can be just such a, yeah,
Yeah.
that's a question.
Depends
But
who's doing research. Is it the breast implant company or is it? And yeah, you need to know who is doing the research, who is sponsoring the research, because that research can be skewed whichever way you want it to go, unfortunately.
no,
Um,
that's so true. That's such a good point to bring up for people too. Like just be aware of that and listen to your body. And I can tell you right now, your your feelings definitely have effect on your gut, and we know the gut's connected to the brain. So
Absolutely.
I mean,
Yeah.
yeah, kudos to you for listening to yourself and getting those out because
Yeah. And I just nodded. I was like, okay. There's no correlation. Thanks. I got it. I took mine out anyway. So I just laughed, but it's yeah, you have to be your own advocate. You have to do your research and just ask questions. And when you don't get the answer, you just keep asking and digging more because, um, yeah, there's, there's, yeah. Okay, the other question I was gonna ask, and I know you said your implants were not very big. It was just a little, cosmetic,
yeah,
for yourself. So I know like removing them probably won't make a big difference in like, how you look and like how you feel. But women that have, or let's say they've had these large implants for years, like what happens? Do you know what happens with like the skin? Do they have to remove some of the skin because there could be like a lot of sagging? Can they do like fat transplant, or I guess they can inject your own fat in there? Like, do you know much about that
yeah, yeah,
protocol?
definitely. This is a good question. I was even shocked with like my implants coming out and like just seeing like the size of the implant because I'm pretty small, right? And then just seeing how quickly my breasts, like the elasticity in our body, just like goes back. Obviously, age, unfortunately, is going to have a factor in the elasticity and stuff. Now, bigger implants, of course, I mean, they can stretch the skin. Um, yeah, I mean, other than that, what was your second question?
Um, like, do you have to like put like fat in there to like support the breast tissue so it's not sagging for people with like large breast implants?
Yeah, so you can definitely do fat transplants. I mean, that's a thing. You can take, usually they take it from a different area, in the body and put it into the breast, depending on your case. But honestly, yeah, you're probably, I hate to say it, it's probably, if you've got these massive implants, it's going to be a little bit harder to just go back to looking completely normal. I will say, like, mine look more normal than I thought they would look. Like they look, even the surgeon said, he's like, and it's probably has to do with how you take care of your body too, right?
Yeah.
No, like that's going to have a factor. But he was like, it's crazy. Like you look exactly how you did before you had the surgery as you do after. Um, I was shocked. I mean, a little like looseness, but I mean, it's been a week. It's getting better and better by the day. And I'm just, doing all the protocols that I talked about, which I think is helping a lot. So I think there's definitely things that you can do to help that. But yeah, if they're bigger, it's going to be a little bit harder for sure because you're stretching out the skin. And also just, let's just talk about like your back. Like
Oh,
me,
yeah.
chiropractic background, like, I mean, even just having the small implants out, like, oh my God, like it feels already so much better. I was like, I need a freaking adjustment. Like I feel like I can breathe. I'm not just like hunched over all the time. I mean, that affects our neck. For like every centimeter our neck is forward, we're adding pounds to our head and the weight of our head. So, I mean, just in general, for your body to feel better, like you're gonna feel better. Like I was actually getting kind of sick of it towards the end. I was like, all right, like I just want to go for a run and like not, worry about like my boobs.
Yeah. That's awesome. That's great. I'm glad. I'm so glad to hear that. That's awesome.
Yeah.
So you also, so you are a chiropractor and you also do a lot of like detox and stuff. Can you tell us a little bit about like, what exactly you do and how people that are maybe interested in working with you, how they can work with you or reach out to you?
Yes, of course. Yeah. So I do a lot of functional medicine and I kind of specialize in the hormones. I would say my niche patient is about 25 years of age to about 45. I don't work necessarily a ton with menopause. That's a whole nother kind of ball game. Um, but I do have a good network of people that I refer to for that. And what I do is basically help patients, females mostly, balance their hormones, figure out the issues of what's going on in their gut, whether that's like, bloating that they're dealing with, severe like constipation, diarrhea, pain. And we dive deep and we do more in-depth labs that a lot of times that unfortunately you don't get, when you just go in for your yearly physical or whatever it is. Fortunately, insurance doesn't cover a lot of those labs because they are more preventative. And we know that's a whole nother story, but I'm doing things like GI maps, which is kind of looking at the large intestine and seeing what's going on. SIBO, if you've heard of that, small intestinal bacterial overgrowth, there's another test you can do for that. It's called TrioSmart. That's a more in-depth gut condition. So we're really diving deep and trying to find out the root cause. I do a lot of Dutch testing, which is going to look at of all of our female hormones. And it actually looks at methylation as well, cortisol, adrenals, all that kind of stuff. And yeah, obviously it's all based on patient and the case, but when patients work with me, they get a 13-page intake form, which is pretty in-depth, and it goes from like family history way back till when they were born till now. And we kind of just analyze that and then figure out what's going on for that particular patient, what labs maybe we should order. Maybe labs aren't necessary. Maybe we just try some sort of protocol at the beginning. But it's obviously patient based, but that's a lot of the stuff that I'm focusing on. I hope that made sense. I feel like I was rambling.
No, that's awesome. And what's the best way to reach out to you? Do you have like a website or is it through Instagram or is there a particular place where you like people to reach out if they want to work with you?
Yeah, Instagram's great. It's easy. My website, I have a link tree on my Instagram bio. It's linked to my website for my separate supplement websites on there, as well as my regular Detox Docs website. All of my programs, one-on-one, that free downloadable. If you're listening to this and you're thinking that you need to get your breast implants out, that's it. I mean, it's a super short 3-page document, but it's a really easy thing to just download. Yeah, so their Instagram, Facebook. I'm on Facebook as well, but I would say Instagram is probably the easiest way.
Awesome. And I'll link all that below. Yeah. I love it. I thank you so much for sharing that. It's really great to see, another doctor sharing this and really standing up for, your body and how you feel. And, obviously you're a detox doc as well. And,
Yeah.
that I love that you are sharing this and following your passion and your gut feelings and just wanting to feel the best. So
Yeah,
because
it's good to know like
yeah,
other practitioners, especially, as like your background too, as a nurse anesthetist, like it's just great to know that there's practitioners out there, whether it's like Western or more holistic, that can kind of come together, I feel like, and just,
yeah. And we
yeah,
need more and more of that because I just feel like there's that bridge that needs to be um, filled between like a physician MD and the patient. There's so much gray area that there's a lot of information that is being missed. I'll run into a patient or talk to a patient that's on 3 different blood pressure medications and their blood pressure is 160 over 100.
yeah.
And I'm like, do you check your blood pressure? They're like, no, they check it every 6 months. Every 6 months, when I go for my yeah, and I'm like, you need, it like blows my mind. So I try to educate, like, hey, if you go to Walgreens or if you go to Walmart, there's a blood pressure medicine in the pharmacy. Just check it, write it down in your phone. Because when you go every 6 months, it might not be accurate. And sometimes these medications need to be adjusted up or down, whichever. And the
Yeah.
end goal is to get off of some of those.
Amen. And there's so many things we can do,
Yeah,
holistic, where we just have to jump to a medication. And I think that's the thing. Like medications, they do save lives in certain
yeah.
circumstances, but like just knowing that, you're in that field and like you're doing that, like is just it's just great because you don't hear that enough, which is I think is amazing.
Yeah, I try a little bit here and there whenever I get a chance, but you can't do so much because you're prepping them for surgeries and you notice these things and you try to do just a little education, not like, yeah, just a little bit. And
Still do it one way.
yeah, I mean, you hope that it helps a little bit, but
Yeah.
yeah, no, I love it. And thank you for being an advocate for health and detox and women's health, especially hormones, because you see so many things like early on now, the PCOS, weight gain, all the stuff that we really didn't used to think about back then. But now with food, the stress, the environmental, everything, there's so much that
Oh
we
my.
need to like dig into. And it's not just like, take a pill, let's fix it. And like you said, gut isn't it? They call it like the second brain.
It
Like
is.
it's
I would say
right.
it's the first brain. I call it the first brain because
Yeah.
honestly, our vagus nerve is literally connected, right, to our gut, and what's going on there is what's going back up to the brain. So, I mean, people call it the second, I call it the first, but
Yeah, no, I agree with you. I agree. I mean, because if you have gut issues, this brain is not working. Brain fog, everything. And I've been there. I've had a lot of those issues and struggled with it for like 10 years or so as a practitioner. And I
it's
didn't know, like I kept going back. I'm like, what's wrong with me? Why can I lose weight? Why can I feel good? And sometimes it's a lot deeper than just like food or exercise. Yeah.
yeah,
So
it
no,
is.
thank you.
Yeah, there's tests that you can do to figure that out as well that people
Yeah.
don't even realize. So,
So yeah, feel free to reach out to Dr. Austyn if you are having those issues or you've been struggling with it for a long time, because there is hope and you should never stop searching for it, because we deserve to feel amazing and we deserve to feel the best that we can. So
Yeah.
again, thank you so much for sharing. My last question, my favorite question I like to ask all my guests is, what are the three things you wish you had known sooner, related to anything in your life, health, relationships, just life?
Yeah, I think, okay, so my three things, if we're just talking about anything in general that I wish I knew sooner, would be to, number one, just not give a crap what people think, because I think that can set you back in so many ways, and that actually can affect our physical health. Number two, I would say, just like if I'm going in like a food standpoint, being aware of like how inflammatory some foods are and how things are processed, like gluten. Staying away from like those just like crack foods is what I call them, because they're literally meant to be addictive. And number three, I would just say to, not let a doctor, whatever type of doctor it is, let you down or put you down, because I've been there and I've cried and I've spent so much money and got no answers. So just be your self advocate, because I didn't do that a lot at the beginning. And I feel like, later on I did, and it made a huge difference. So don't give up. I guess that's four, but yeah, those would be the three things that I would.
Those are awesome. Thank you. Thank you so much for sharing, and thank you for taking the time to chat with me and share your story with others, that I hope that it will help as well for those who are maybe having the same questions, or maybe trying to decide about their breast implants or other implants like my Brazilian butt implant. And,
Yeah, oh, you
I
got
know
me
now people are going to believe me that I have Brilliant.
on that.
I've actually been asked before I had Brazilian butt implants. I'm like, no,
Good.
that's squat. That is squat.
That's just your genetics
Yeah,
and squats.
that's a squat. Yeah. So,
Amen, girl. All right.
yeah.
Well,
Well, thank you so much. I'll share all your information in the description, and I look forward to connecting with you again, and following your story and everything else that you share.
I can't wait. Thanks so much. Have a good one. I